Hi, my name is Rebecca, and I will be presenting the role of simulations in nursing education. So we start by asking, what is a simulation? And a simulation is a recreation of events that help to develop learning skills. These simulations can be done by using mannequins, kind of like Sims Lab in nursing school. They also have some web-based applications to do simulations, as well as virtual simulations. The goal of these simulations is to develop cognition, ethics and roles, and the capability to apply the skills that you are learning in these simulations in real life. So, for example, in the past few years, if you have taken a BLS course, that is a great example of a simulation that teaches you the necessary skills to assess a patient and apply the steps of basic life support accordingly. And what that simulation also does is it provides you with feedback if you skipped a step or if you were too slow on a step. It provides you with appropriate feedback to go back and review what you need to review in order to improve on your skills. There are four main components of a simulation. You have a pre-briefing, an enactment, a debriefing, and an assessment. In your pre-briefing, you will be told what the goal of the simulation is and how you are to achieve that goal. In the enactment, of course, you are in the simulation, doing what it is that you need to be doing. And in the debriefing is where you take from that simulation, okay, what did I learn? What do I need any improvement on? Was this an appropriate simulation for what I was learning? Are there ways that this simulation could have been better or could have helped me in a different way? And then you have the assessment, which if your teacher's not involved, if you're doing the BLS course that I described earlier, there will be an assessment that tells you, how long it took you to identify XYZ, or how long it took you to begin compressions, stop compressions, all that good stuff. Whereas if you have a teacher involved in your simulation, say like in a Sims lab, your teacher will give you your assessment of what you did good on, what you may need to improve on, and therefore. Interestingly enough, there is not a lot of information out there on the benefits of electronic health records simulations for nursing education. We have skills labs where we learn all of our nursing skills, but the majority, if not all, of our health record learning comes from our clinicals within the hospital itself. But what we can learn about the benefits of electronic health records is that they do improve surveillance and monitoring of the patient, labs, vitals, which end up improving patient care. There is also an association with decreased medication errors as opposed to using paper health records. And there is also an increased adherence to evidence-based practice. This may come in with Epic, where Epic sort of has these preset designs for whatever information that you input into the computer. It will kind of alert you to, hey, this patient may be leading towards sepsis, or, pretty much kind of tries to help guide you in caring for this patient and what you may need to alert the physician to. In a very small study of nursing students, it was found that there were some positive qualities for having electronic health record simulations in nursing education, and there were some negative qualities as well. The positive qualities included better quality information and better record keeping. So whenever you have everything pertaining to the patient at your disposal, it does allow you to put the information together easier, hopefully, and may give you a better overall assessment of what is actually going on with this patient. However, the negative qualities were that it is time consuming, because as students we are also having to do a few things on paper, and we may just now be learning these EHRs, and there are many different styles of EHRs. So there's also a discrepancy between when we're caring for our patient and when we're charting that we cared for our patient. So in real practice, a lot of times we call this back charting, and it is frowned upon. However, sometimes it is necessary to do in order to get all of your tasks done for the day and take care of your patient in a quality manner. And another negative quality for EHR simulation in nursing education is where you're doing your care versus where your computer is that you're charting at. So a lot of times in clinicals, you will run into the issue of having maybe only 5 extra spare computers, but you have 12 nursing students. So all of these nursing students are having to share the computer. And a lot of times it's kind of just whoever gets to it first. And you may be waiting a few minutes to hours before you're able to document what you did, document that you gave a medication, or document that you spoke to a nurse or physician. There are some great advantages to incorporating simulations into nursing education, and one is that certain simulations do provide you with a realistic learning experience, and those simulations are often done in a controlled, safe environment, and there is no risk to an actual patient while you are learning. A good example of this would be in Sims Lab, for if you're learning how to place an NG tube or a Foley catheter, or even start an IV. Another great area that you can experience this in is if you are doing a BLS course, for example, because these BLS courses are timing you appropriately for how long are you doing your compressions for, how long are you giving breaths for, are you switching roles in a quick enough manner, are you getting that defibrillator on in time, and so you're learning the skills that you need to learn, but there's not a real patient there for if you mess up, that patient may expire. Some disadvantages to simulations in nursing education include the lack of feedback for learners. This, to me, is, say, your charting. So if you're at a hospital charting, there's nothing that's going to tell you that you did not chart something appropriately unless your teacher or your nurse catches it. There's nothing that's going to say, hey, this is a better way to phrase this wording here. The other thing is that sometimes these systems are complicated, and whenever we are learning at a new hospital, we're having to kind of start all over and learn the system, and that does take away from us, finding data that we need to find and finding the documentation that we need to find in order for us to get a well-rounded picture of what is going on with this patient. Now, as far as bringing this simulation EHR into nursing schools, it is very costly. Not to mention having to customize it to your school or to, what your program designates as necessary. So the disadvantages kind of lead us into the challenges of EHR implementation in nursing education. Ideally, it would be great for all nursing students to have a test EHR at their disposal to be able to go into the SIMS lab and work on their documentation and work on how to find the appropriate data that they need in order to fully assess their patient. But the challenges are the cost. These programs are extremely expensive. I don't even have a ballpark, but I do know that they are expensive. As far as getting them for a hospital, they're upwards in the millions. And then instructor and learner usability. There's going to be a learning curve, not only for the learner, but for the instructor as well. With all things informatics, there is going to be IT support that is going to be needed because, of course, something is going to go wrong. The administration or the instructors would also have to create a patient database development, and that does take out of time for teaching classes and doing clinicals, or the teachers would have to have all this extra work loaded on top of them. Other things would include simulation materials. So will there be extra cost, or will there be extra programs that are necessary to get the ball rolling? Customizability also kind of plays a role into like the patient database development, where how easily can you customize these issues with these pretend patients, or are there just certain guidelines that you have to follow? And then, of course, fidelity. How real are we getting to a real life patient? Because that would be the goal of having an EHR simulation at your school, is the ability to get a program to be so lifelike, so real, that it feels like you're actually taking care of this patient. It feels like you're actually making a care plan and using your critical thinking skills in order to help the care team heal this patient and get this patient to where they need to be. There's a lot of room for simulation in the future of nursing education. One of the big things that it seems like they're trying to really work on and incorporate is virtual reality simulations, where you can kind of check off your steps, but also go in order that's not chronological, because not everything in real life happens in a 1, 2, 3 order. And so that really helps you with your job related practice, as far as whenever you get on the job, you're not thinking 1, 2, 3, you're thinking, what's my next step? What is my next appropriate step? These simulations also help to increase the nurse's confidence in the job that they are doing, in the skills that they are doing, because that is one thing that, brand new nurses may struggle with is a lack of confidence because they haven't had much training. These types of simulations are also proven to reduce errors, improve patient outcomes, and ultimately save lives, because whenever we're practicing our skills more, there will be less room for extraneous errors. They also allow for more opportunities for hands-on training and critical thinking skills. And when I say hands-on, I don't mean like literal hands on a patient, but if you're in a virtual simulation and there is a virtual patient there, then you're actually getting to, see that patient, assess that patient for however it's programmed. And what that can do is to help your critical thinking skills for real life situations. You can say, okay, I've kind of done this in a simulation, and apply it to whenever you're at work and on the job. So ultimately, simulations in nursing education, we do have some things to overcome as far as how to better incorporate these. But the benefits of simulations in time will outweigh all of those issues that we will have to overcome.